Most people don't think of dermatologists as treating patients in the hospital. In fact, dermatology is predominantly an outpatient specialty. There is a subset of people who, like myself, who are interested in taking care of patients in the hospital setting. We liked internal medicine a lot. Some people are double boarded in internal medicine and dermatology. We like the hospital setting. We like the sick patient. So we tend to think more like an internist in the sense of what is the worst thing that can happen to this patient that I need to prevent from happening in the first 24, 48 hours of my seeing them, and how do I keep them from, for example, the significant morbidity or mortality of what could be the worst thing that they have. That's very different than acne therapy or outpatient psoriasis therapy, which typically is topical therapy and sometimes systemic therapy. So you can have a skin condition that it gets so severe that you are hospitalized. So, for example, really bad atopic dermatitis or erythrodermic psoriasis or a severe drug reaction with systemic symptoms. That's a dermatologic disease that would require hospitalization. Or you can be in the hospital, for example, you're immunosuppressed for a transplant and you are prone to infection, you develop a disseminated fungal infection, for example, it manifests on the skin, and the dermatologist is called to come and evaluate that skin lesion to facilitate making diagnosis and starting therapy. Many ways. So first of all, these patients are generally sick enough to require hospitalization, meaning they need frequent monitoring of their skin condition, whether it means that their skin might be, in layman's terms, falling off or breaking the barrier so much that it requires really close supervision of their skin, so they're prone to infection. They're also prone to have systemic abnormalities, liver failure, kidney failure, blood abnormalities. They also might have, if they're already hospitalized and they have a cutaneous manifestation of something they're hospitalized for or a consequence of their hospitalization, that they're already there, and usually that is quite severe. So the indications usually are something that can't be managed in the outpatient setting and or have such high risk of systemic complications that they require closer monitoring and treatment in the hospital. Then there's some skin diseases where you really can't, they might have gotten so far out of control that they require a medication that can really only be safely administered in a hospital setting. For example, pulse Medrol for pemphigus vulgaris, it gets really, really bad, would be a good example.